Hello, my name is Liz Bradley and I'm a specialist dietitian working in the NET team at the Queen Elizabeth Hospital in Birmingham. NC UK have asked me to talk about nutrition in gastroenteropancreatic neuroendocrine cancers, or GEP-NETs. So the plan for the session today is to discuss the following. So I'm going to go through the role and relevance of diet in GEP-NETs, an overview of what constitutes healthy eating. Then we're going to go through malnutrition. What is it and why does it matter? Then I'll talk about troublesome bowel symptoms, the common causes and potential treatments for people with GEP-NETs. And then we'll talk about micronutrients, so vitamins and minerals. Do we need to be concerned about these? And if so, which ones? Okay. So to start with then, so the role of diet in GEP-NETs. So essentially, diet is something that you can control yourself, which for some people is something that they really like, whilst others find it quite daunting and a bit of a challenge. So I'm going to try and explain the easiest way to do something as we go along. Generally, the role of a good diet is to help maintain a healthy weight and a good functional status whilst preventing nutritional deficiencies. Achieving this can help to optimize treatment outcomes alongside stabilizing your weight. A good balanced diet with a variety of food and sufficient protein can help to reduce the recovery time following operations. It can maximize the outcome of your treatment medications and also help them to have fewer side effects. It can also be useful in managing symptom control, and we will talk about that in a bit more detail later. So I think an important thing really to bear in mind is that there isn't just one diet for all when it comes to NETs, because there are lots of different types of NETs which occur in different locations. Even when we narrow it down to GEP-NETs, there's lots of different types of NETs, and they can all have very different consequences. Also, different people will have different treatments, and one patient might have a very different set of comorbidities to another. And all of these things can impact on your individual nutritional needs. So I think that's important to bear in mind. It isn't a one size fits all. However, I do think a good starting place for most people is what we call the Eat Well plate. So this is the Eat Well plate, and it's national guidance on healthy eating for the whole UK population. If you are a healthy weight, not losing weight, and not struggling with your bowels, then this advice is suitable for you. The advice essentially constitutes of a plate that demonstrates how we should be balancing the proportions of various food groups in our diet. So you can see from this, the largest food groups that we should be consuming are fruits and veg, and then starchy carbohydrates. So we should be getting about a third of our diet should be made up of fruits and vegetables, and we should be aiming for at least 5 portions a day. And then another third of our diet should be made up of starchy carbohydrates. So that's things like bread, rice, potatoes, and pasta. And these foods are really important for energy, as well as fiber and some vitamins and minerals. We then get smaller portions, well, we should have smaller portions of foods such as proteins. So they're things like meat, fish, eggs, beans, pulses, that sort of thing. And then some dairy, which is important for things like calcium and also certain vitamins. We should be having minimal amounts really of things that are very high in fat and high in sugar. So you can see there, the very small purple section is our fat. So we do need a little bit of fat in the diet, things like oils and spreads, etc. But we should be keeping them to a minimum. And then you can see outside of the plate entirely are the kind of the treat foods, your cakes, biscuits, crisps, sweets, those sorts of things, which we don't really need in the diet, but it's okay to have in moderation. So if we go through nutritional issues in GEP-NETs, so the more common issues that affect people with GEP-NETs are the following. So things like weight loss or malnutrition. Some people have difficulty with weight gain. Others have difficulty with their bowels, so symptoms like diarrhea or steatorrhea. Steatorrhia is funny coloured stools, so pale yellow, orange or greasy looking stools, and that's a symptom of fat malabsorption. Sometimes people might develop bowel obstructions, which can make it very difficult, if not impossible, to eat. And sometimes people will have micronutrient deficiencies. So if we start with malnutrition, when referring to malnutrition, I mean unplanned weight loss, having a low BMI or low muscle mass or active muscle loss. Recent research has shown that malnutrition affects about 40% of patients with GEP-NETs, and it's more if you also have carcinoid syndrome, so it could be up to 60% in that group. And it's much more common in GEP-NETs than in bronchial or unknown primary nets. The consequences of malnutrition are quite significant. There has historically been lots of research to demonstrate the impact of this in other cancers, but recently there's been more and more evidence specific to NETs, which is growing. So studies have shown that malnutrition is associated with a poorer prognosis, increased time in hospital, more complications, reduced tolerance to treatments, and it's also linked to fatigue. So for all of these reasons, it's important to try and prevent or treat malnutrition. Studies of the body composition of patients with cancer have shown that it's specifically the loss of skeletal muscle, with or without fat mass, which is the main aspect of cancer-associated malnutrition that predicts risk of physical impairment, post-operative complications, increased toxicity to chemotherapy, and increased mortality. So when we're trying to prevent or treat malnutrition, what we're really trying to avoid is muscle loss. So we're always trying to avoid or reverse muscle loss, essentially, when we're worried about malnutrition. And so to do this, we would usually go for a nutritional support approach. So that, for these people, that is quite different then from that Eat Well plate that I showed you earlier. You might be wanting to have then smaller portions of things like fruits and veg, which are quite low in calories and don't really contain protein. And you will most likely need greater portions of those other food groups. So certainly more of your kind of starch carbohydrate group, more of your protein rich group, and possibly more of the sort of high fat, high sugar foods as well for calories. So the usual first line advice for people who are malnourished is to aim for regular meals, to have extra snacks, nourishing drinks, and to choose high energy and protein foods. So usually, as I say, this means focusing more on your high protein, high carbohydrate type food groups. If someone cannot prevent weight loss that way or cannot reverse their malnutrition that way, then we may have to use nutritional supplements, some of which can be prescribed. If that's not sufficient, then we would usually use something like tube feeding, or if your gut isn't working, if you've got something like a severe bowel obstruction or gut failure, then we might use something like parenteral or intravenous nutrition. It's also really important to make sure that people can digest the nutrition that we're giving them. So that would also be another important aim for someone who's malnourished, is to try and normalize their digestion as much as possible. And we're going to talk about that in more detail later. And then it's always important to avoid being sedentary where you can. It's really important if you're going to try and maintain or build muscle, you can't just feed them, you also need to use them. And we'll talk about exercise in a little while. Okay, so to begin with, proteins are a really important structural and functional element within every cell of your body, and they're involved in a wide range of metabolic interactions. All cells and tissues contain protein, so protein is essential for growth and repair, and it's really important for making and maintaining muscle. The optimal protein supply for cancer patients has not yet been determined, and we know that old age, inactivity, and systemic inflammation are known to induce anabolic resistance, i.e. they decrease the responsiveness of protein synthesis to anabolic stimuli or make it harder to build and maintain muscle. But muscle protein synthesis has been shown not to be completely cut off in patients with cancer. Several studies have shown that it is possible to build muscle in response to the supply of protein. and that we think that people with cancer may need up to 2 grams of protein per kilogram of their body weight. However, we also know that you can only use about 30 grams of protein at a time. Any more than that in a meal is unlikely to be beneficial. So at the moment, the average person in the UK tends to eat most of their protein in their evening meal and very little at breakfast and lunch. But we know that it's actually much more effective if you spread that protein out. So if you have sort of roughly 30 grams of protein at each meal, and probably before bed actually, and there's also some evidence to show that that's quite effective. And we know that protein in combination with exercise is your best option for building muscle. Here's a slide showing you different types of foods that are rich in protein. So foods vary in the amount of protein they provide, but the main sources include meat, fish, eggs, milk, cheese. And good vegetarian sources include nuts and pulses, i.e. beans and lentils, corn, tofu, and soya. So having good amounts of protein spread over the day is likely to be the most beneficial, but having good quality protein is also important. We know that proteins from animal sources have a higher biological value than protein from plant sources. And this is because the pattern of amino acids in animal cells is comparable to the pattern in human cells. But if you're vegetarian or vegan, it's helpful to have a range of protein sources in your meals to increase the biological value. And this is known as the complementary action of proteins. So this slide just demonstrates how much protein you can get from different foods. As you can see, it is quite variable. And then on to exercise. So regular exercise is known to help prevent muscle loss, to help build muscle, and also has several other potential benefits on your general health, your mood, and also managing fatigue. Reassuringly, it's been shown to be safe and effective for people with cancer. And if structured exercise feels unrealistic or unappealing, then don't worry. Just being physically active is really good for you. So this is the current UK guidelines for activity, and it advises that all adults should aim to be physically active every day. Any activity is better than none, and more is better still. Do strengthening activities that work on major muscles such as your legs, hips, back, abdomen, chest, shoulders, and arms on at least 2 days a week. So that could be something like yoga, Tai Chi, lifting weights, lifting heavy shopping, using resistance bands, heavy gardening like digging. All of those things would count. And then we should also all be doing either 150 minutes of moderate intensity activities such as brisk walking, dancing, playing tennis, or cycling. So this should be something that makes you feel warm and get a little bit out of breath, but you should still be able to hold a conversation. Or instead of the 150 minutes of moderate intensity activity, you could do 75 minutes of vigorous activity a week. So that's something like running, riding a bike, skipping. This is something that should make you feel very warm and quite out of breath. You should be able to say a few words, but not really hold a conversation. And lastly, we should all reduce the time we spend sitting or lying down and break up long periods of not moving with some activity. For example, if you're sitting and watching a TV, try to get up and walk around every 30 minutes. Maybe have your remote control on the other side of the room so that you have to get up to change the channel, that sort of thing. You can find out more if you search for NHS Live Well online. There are things like exercise plans for beginners and also fitness videos that you can make use of. There's also separate guidance available if you're over 65. So going back to malnutrition, so when we talk about malnutrition, it's not just about having the right nutrition, it's also about being able to use that nutrition. So that's where digestion comes in. It's really important that we can digest what's going in. And if we can't, then it's sometimes quite futile, really, having that good nutrition support. So in those with GEP-NETs, diarrhea and malabsorption is unfortunately quite common, and there are lots of reasons why people get these symptoms. So patients can have several of these issues all at one time, and sometimes it can be really difficult to identify which cause or which causes are an issue for them. Sometimes it feels like trying to be a bit of a gut detective, getting to the bottom of these issues, and it can be quite challenging for patients and clinicians. So I'm going to talk through some of the more common causes of diarrhea and malabsorption, the NET patients that I see, and the treatments that we use to help them. Bear in mind that some causes of diarrhea may require medical treatments rather than dietary changes. So for example, diarrhea caused by carcinoid syndrome is likely to be best managed by medical treatment like your somatostatin analogues, surgery, or something like talotrostat. It's very unlikely that you can do very much with your diet really to help that sort of diarrhea. It's also important to remember that people with NETs can have diarrhea from non-NET related issues, just like the rest of the population. So this could be something like an infection, celiac disease, which affects up to 1% of the UK population, lactose intolerance, and other causes. And unfortunately, in some cases, it may only be possible to reduce or minimize the symptoms. It's not always possible to resolve the issue completely. So if we start with pancreatic exocrine insufficiency, so this diagram shows your pancreas, which is a very important gland in your body. So your pancreas usually makes digestive enzymes. They're released into your gut where they help you to break down fat, carbohydrate, and protein. And they help to digest that food and make it small enough so that it can be absorbed through your gut wall. If the enzymes aren't made in adequate amounts, or if they can't get to the right place at the right time, then you end up with something called pancreatic exocrine insufficiency, where you don't fully digest and absorb your nutrition. And this can lead to things like diarrhea and steatorrhea, weight loss, and also vitamin and mineral deficiencies. So, as I say, pancreatic exocrine insufficiency occurs when your pancreas cannot produce sufficient enzymes or doesn't make them at the right time. And the most common cause is things like pancreatic surgery. So if you've had part of your pancreas removed, or maybe your whole pancreas removed, or if you've had surgery to the surrounding areas, so things like your duodenum also can lead to pancreatic exocrine insufficiency. We also find that lots of our patients on somatostatin analogues develop pancreatic exocrine insufficiency because these injections can suppress the enzyme release from the pancreas. It's really difficult to know how many people with GEP-NETs have this condition because the studies looking into it are quite small and quite scarce, and sometimes they use a test which is not very reliable. So instead, we tend to go by symptoms and the clinical picture, and we often just try a course of treatment to see if it helps. And if you do have pancreatic exocrine insufficiency, it is very important to treat it because if left untreated, it can lead to weight loss, malnutrition, troublesome bowel symptoms, and also vitamin and mineral deficiencies, which long-term can lead to significant issues such as weak bones and poor eye health. The common bowel symptoms people report if they have this are things like diarrhea, urgency in opening their bowels, a change in the colour of their stools, such as yellow or orange stools, wind and bloating. And so to treat it, we give digestive enzymes. So we replace the ones that your pancreas would have usually been making with the form of a capsule usually. So these are the common types of enzymes that you might see, and they contain enzymes that help you to digest fat, protein, and carbohydrate. And they come in different sizes and strengths, but unfortunately they all come from pigs. There are no alternatives to this. Moving on to a condition called bile acid malabsorption, which is another potential cause of diarrhea in people with GEP-NETs. So usually our liver makes bile, which is stored in the gallbladder and then released into the bowel where it helps us to digest fat. Our liver only makes a small amount of bile each day, but usually we reabsorb and recycle most of the bile that it makes from the gut in the terminal ileum. If you've had your terminal ileum or your gallbladder removed, this system may be disrupted, and this can lead to a condition called bile acid malabsorption, where the bile salts stay in the gut, which can cause diarrhea, and then over time your bile pool becomes depleted, making it difficult to digest fat, which again can contribute to diarrhea. So a study in 2017 showed that bile acid malabsorption affects up to 80% of patients with GEP-NETs. So this can be checked for with a test called a CCAT test. It can diagnose whether someone has bile acid malabsorption, but it can also determine the severity of the condition. In milder cases, you might be able to adequately treat it with a low-fat diet, but in more severe cases, it may also require medications such as cholestyramine or cholesevelam. A low-fat diet generally means avoiding high-fat foods such as pastry, cream, butter, oils, cheese, and fried foods. But for more support, ask to speak to a dietitian. Another potential cause of diarrhea or troublesome bowel symptoms is something called small bowel bacterial overgrowth. And this is where the presence of excessive levels of bacteria in the small bowel cause gut disruption. So the presence of the bacteria can cause things like gas, so wind, bloating is a common symptom, but it can also irritate the gut lining, causing things like diarrhea and malabsorption. So the same study from 2017 showed that this may affect up to 62% of patients with GEP-NETs. The usual treatment for this is antibiotics. Some patients will also choose to take probiotics to try and prevent this from occurring. There isn't really any scientific evidence to show that this helps, but it is unlikely to be harmful. For general diarrhea of unknown cause, it can be quite helpful to reduce your intake of insoluble fibre. It's also really important to try and stay as well hydrated as possible. So it's important to drink well and also to try and continue to eat well. Limiting your caffeine intake can also help because caffeine can have a laxative effect, and it might be useful to take medications such as loperamide to try and prevent the diarrhea and make the symptoms a bit more manageable. These are some examples of high fibre foods which might be helpful to limit if you're having problems with diarrhea, and some low fibre alternatives that might be better. Lots of patients ask me if there are foods that they shouldn't eat because they have a NET, and the short answer is not really. As I mentioned previously, you should be aiming for a fairly normal and varied diet. However, some people with carcinoid syndrome do report worsening of their symptoms, so things like flushing and diarrhea, if they have certain things. And the most commonly reported problem foods are things like spicy foods, alcohol, and having very large meals. I think it's reasonable if you're having symptoms with those things to cut them out or try and limit them. There is also some evidence that amines may also be a problem for people with carcinoid syndrome. This was really based on a survey that was undertaken many years ago by the Carcinoid Cancer Foundation, and it just looked at patient-reported problem foods. In this survey, 35% of patients reported a reaction to foods, of which the most common were these were those high in amines, and these foods are listed above. I would only suggest really cutting these out if you feel that you cannot tolerate them. Otherwise, I would eat them as normal. So nutritional deficiencies will really depend on your clinical picture and any previous surgeries that you've had. If you've had untreated steatorrhea or malabsorption for a long time, you are at risk of having a deficiency in your fat-soluble vitamins. So that's things like your vitamins A, D, E, and K. If you're worried about this, you can have your blood levels tested and you can have these supplemented. But in this case, it's really important to try and treat the cause of the malabsorption. For example, if you've got pancreatic exocrine insufficiency, then it would be best to take the enzymes rather than just supplementing the vitamins. If you've had your stomach or terminal ileum resected, then you're at greater risk of B12 deficiencies. And if you have carcinoid syndrome, your risk of B3 or niacin deficiency is also increased. So moving on to B12 specifically. So we all need B12 for some essential functions within our body, like maintaining a healthy nervous system and making red blood cells. Having low levels of this can lead to a type of anemia. So we usually get it in our diet from foods that are rich in proteins such as meat, fish, and dairy. And studies have shown that about 40 to 60% of patients with GEP-NETs may be deficient in B12, but that supplementation is very effective in treating this. If you've had your stomach or terminal ileum resected, then you should be receiving B12 injections every 3 months. If you're on an SSA treatment or you're worried about your B12 levels, then it may be sensible to take a supplement. Alternatively, you could ask your GP or NET team to check your B12 levels. Niacin, or vitamin B3, is a vitamin that we make from something called tryptophan. We get tryptophan from protein-rich foods in our diet, such as meat, fish, eggs, cheese, etc. Most of us get enough from our diet, but if you have a serotonin-producing tumour, you may be deficient because your body preferentially uses the dietary sources of tryptophan to make the serotonin instead, and doesn't always have enough left to make your vitamin B3. Vitamin B3 deficiency can result in a condition called pellagra, which can cause dermatitis, diarrhea, dementia, and even death. So it's important to identify and treat any deficiencies. However, the difficulty is that it's not easy to check for B3 deficiencies. The best method is thought to be using urine samples. A study in 2016 in the Netherlands found that about 40% of patients had low niacin levels, although none had developed pellagra. The study also demonstrated that supplementation was effective at treating deficiencies. So if you have carcinoid syndrome and you're concerned about your B3 or niacin levels, then I would ask your local team for advice, or it may be sensible just to take an over-the-counter vitamin B supplement. Moving on to vitamin D. So vitamin D is really important for our bone health. There is also a small amount of evidence that vitamin D deficiency is associated with reduced survival in NETs. We usually make vitamin D from the sun, but in the UK we can only do this from March to September. Therefore, deficiencies are quite common in the general UK population, affecting about 1 in 5 of us. And the rates seem to be further increased within the NET population. But vitamin D supplementation has been shown to be effective in correcting deficiencies and improving bone mineral density in patients with NETs. So if you're concerned about your vitamin D levels, you can ask your GP or NET team to check them for you, or alternatively, you may wish to take an over-the-counter supplement, especially during the winter. So in summary, one size does not fit all. Your dietary needs will really vary depending on your clinical situation and the treatments that you're having. Overall, it's really important to avoid muscle loss, and I would suggest not cutting out whole food groups, but trying to aim for a balanced diet. And remember that exercise is really good for all of us. These are the references for the studies that I've quoted today.